Hello, class, and welcome to my presentation on Hidradenitis Suppurativa. My name is Lauren Baker. During the time of discovery, it was seen as a tumor, which at that time meant enlargement of the sweat glands. It was later concluded that a keratinous plugging of the epicrine sweat duct and follicular occlusion were to blame. Reviews. When infected, pockets under the skin fill with pus, abscess, and can smell bad when they burst open. HS appears to be a genetically heterogeneous disease with several mutations at various locations. Although not one thing can be attributed to causing HS, some of the known causes and triggers are listed on the screen. Those commonly affected are listed on the screen. Displayed on the screen, you may notice that the areas of the body affected are usually warm, moist areas where skin touches and folds. Symptoms can only be identified by clinical features and chronicity. There is no biological or pathological test. Painful bumps under the skin, in the hair roots, near some of the sweat glands are extremely painful and often leave deep, folded scars when they heal. They may be chronic with intermittent release of serous, purulent, or blood-stained discharge, and frequently produce foul odors from anaerobic colonization. It persists for months, sometimes years, unless properly excised. Santé. The diagnostic criteria was adopted in March 2009 by the Congress of the HSF Foundation. It is diagnosed by the typical lesions that are deep-seated, painful nodules, abscesses, bridge scars, and open comedones in secondary lesions. The typical topography is the axilla, groin, perineal, and perianal region, buttocks, infra, and intermammary folds. Lastly, they need to be chronic. These three criteria must be met for establishing the diagnostic. Many people think that the bumps are caused from bad hygiene, STDs, or that they are contagious. All of these are false. The location of the lesions may lead to social embarrassment and the failure to seek medical treatment. Treatment depends on what stage of Hurley's classification the condition is. Stage 1 is non-scarring inflammatory lesions and abscess formation without sinus tract. Stage 2 is separate lesions, consisting of recurrent abscesses with tunnel formation and scarring, and single or multiple lesions separated by normal-looking skin. Stage 3 is multiple interconnected tracts and recurrent abscesses and/or lesions with tunnel formation, scarring, and inflammation. Alicon. In addition to those listed on the screen, some antibiotics may include topical treatments, including antiseptics, clindamycin, tetracycline, cephalosporin, M-type penicillin, and amoxicillin with clavonic, just to name a few. Botulinum toxin injections have been used with claimed good results. Anti-TNF stands for tumor necrosis factor alpha inhibitors. All these treatments will help with stage 1 and 2. After the pus is drained, it is followed by packing. The aim of the incision is to evacuate a collection of pus, i.e. an abscess, in order to alleviate pain. The second surgical method is pictured on the slide. A more permanent cure can only be obtained by wide surgical excision. It must be wide and deep enough to remove all suppurative lesions and tracts, but such a procedure is only considered only in case of advanced disease stage 3 or severe stage 2. Considering the high risk of cancer, radiotherapy should be considered with caution. CO2 laser excision is used in mild to moderate disease with secondary healing. Newer surgical approaches include skin tissue sparing excision with electrosurgical pilling. Shelley. In conclusion, I chose hidradenitis suppurativa because a few members of my family and I suffer from this condition. Knowing personally how embarrassing and difficult it can be living with this, my goal is to become a dermatologist and help those that struggle with this, as well as various other diseases and disorders that affect the skin.